Osteoporosis is a silent condition. It can slowly weaken your bones without you knowing. Many people do not feel any symptoms until a bone breaks. For older adults, a broken bone can change life completely. It can lead to pain, loss of movement, and even loss of independence. That is why preventing osteoporosis is very important. Most people think osteoporosis only happens to women, but it can affect men too. In fact, 1 in 5 men over age 50 will break a bone due to osteoporosis. For women, the number is even higher. Nearly 1 in 2 women over 50 will break a bone due to this condition. Another common misunderstanding is that calcium is the only thing you need. Calcium is important, but it is not the whole story. There are other nutrients and habits that play a big role. This video will help you understand how to keep your bones strong, even as you age, and we will go beyond calcium. Now let us understand what osteoporosis really is. Your bones are living tissue. They are not just hard sticks inside your body. Bones are always changing. Old bone tissue is broken down and replaced with new bone. This process keeps bones strong and healthy. When we are young, we build more bone than we lose. But as we age, this balance changes. After age 30, bone building slows down. By the time we reach our 50s or 60s, we begin to lose bone faster than we make it. This is a normal part of aging. But for some people, the bone loss becomes too much. The bones become weak and fragile. This is what we call osteoporosis. Think of your bones like a honeycomb. In healthy bones, the holes in the honeycomb are small. In bones with osteoporosis, the holes become larger. This makes bones more likely to break. Even a small fall can cause a serious fracture. The most common places for these fractures are the hip, spine, and wrist. A hip fracture can lead to surgery, hospital stays, and months of recovery. A spine fracture can cause pain and make you shorter over time. Many people lose height and begin to stoop forward because of spinal fractures. The scary part is that osteoporosis does not hurt. You do not feel your bones getting weaker. That is why it is sometimes called the silent thief. It steals bone without warning. But here is the good news. You can take steps to slow down bone loss, and you can even build stronger bones with the right habits. This video will show you how. Calcium is the most well-known nutrient for bone health. It is the main building block of your bones. About 99% of the calcium in your body is stored in your bones and teeth. Your body uses calcium every day. It helps muscles move, it helps nerves send messages. It even helps your blood to clot. If you do not get enough calcium from food or supplements, your body will take it from your bones. Over time, this can make your bones weaker. That is why getting enough calcium is very important. But just eating calcium is not enough. Your body needs help to absorb and use it. Think of calcium like bricks. You also need workers and cement to build the wall. In this case, other nutrients like vitamin D, vitamin K2, and magnesium act like those helpers. So how much calcium do older adults need? Women over 50 and men over 70 need about 1-200 milligrams per day. This is equal to 1 cup of milk, about 300 milligrams, 1 slice of cheddar cheese, about 200 milligrams, 1 cup of cooked broccoli, about 60 milligrams, 1 container of plain yogurt, about 400 milligrams. So if you eat 1 cup of milk, a slice of cheese, and a cup of yogurt, that gives you around 900 milligrams. Then, you can add some leafy greens or almonds to get the rest. If you do not eat dairy, you can try alternatives. Many soy milks, almond milks, and cereals are fortified with calcium. Always check the label to be sure. Some people cannot get enough calcium from food. In that case, a supplement may help, but be careful. Too much calcium from supplements can cause problems. It may lead to kidney stones or even heart issues. That is why most experts suggest getting as much calcium as possible from food first. Supplements should only fill in the gap if needed. Also, do not take more than 500 to 600 milligrams of calcium at one time. Your body cannot absorb more than that in one dose. But again, calcium is not the whole story. Even if you get enough calcium, it will not work well without the help of other nutrients. That is what we will talk about next. Let us talk about the other important nutrients your bones need. These include vitamin D, vitamin K2, magnesium, and protein. We will start with vitamin D. Vitamin D helps your body absorb calcium. Without vitamin D, most of the calcium you eat will go to waste. Many older adults do not get enough vitamin D. This is because your skin makes less vitamin D as you age. Also, if you stay indoors most of the time, you are not getting sunlight, which helps your body make vitamin D. So how much vitamin D do you need? Experts recommend about 800 IU to 1000 IU per day. This is about the same as 1 small piece of salmon, about 3 ounces, 2 cups of fortified milk or plant-based milk, a serving of fortified cereal. Egg yolks and liver also have small amounts of vitamin D, but it is hard to get enough vitamin D from food alone. That is why many people take a supplement. If you take a vitamin D pill, make sure it is D3. Vitamin D3 works better than D2 for raising levels in your blood. Now let us move on to magnesium. Magnesium helps with bone formation. It also helps your body process calcium and vitamin D. Women need about 310 to 320 milligrams per day, and men need about 400 to 420 milligrams per day. This is equal to 1 cup of cooked spinach, about 150 milligrams, 1 ounce of almonds, about 80 milligrams, half a cup of black beans, about 60 milligrams. If you eat a mix of nuts, seeds, beans, and leafy greens, you will likely get enough magnesium. But be careful with magnesium supplements. Too much can cause diarrhea or stomach upset. It is better to get it from food when possible. Next, we have vitamin K2. Vitamin K2 helps calcium go into your bones and stay out of your arteries. This is important because you want calcium in your bones, not in your blood vessels. Vitamin K2 is found in fermented foods like natto, a Japanese soybean dish, and in small amounts in cheese, egg yolks, and meat. If you do not eat these foods often, you may consider a supplement, but talk to your doctor first, especially if you take blood thinners like warfarin. Vitamin K can affect how those drugs work. Now let us talk about protein. Many people do not know that bones are part protein. Protein gives bones their structure and strength. Older adults often eat too little protein. This can lead to weak muscles and weak bones. A good goal is to eat 1 to 1.2 grams of protein per kilogram of body weight each day. For example, if you weigh 60 kilograms, about 132 pounds, you need around 60 to 72 grams of protein daily. That is equal to 1 egg, 6 grams, 1 cup of milk, 8 grams, 3 ounces of chicken, 25 grams, 1 cup of cooked beans, 15 grams. Try to eat some protein with every meal. It also helps keep your muscles strong, which lowers your risk of falling. Remember, all these nutrients work together. Think of it like a team. Calcium is just one player. To keep your bones strong, you need the whole team. Food is only part of the solution. To keep your bones strong, you also need to move your body. Exercise is one of the best ways to protect your bones. Bones are like muscles. They become stronger when you use them. When you move and put weight on your bones, your body builds more bone tissue. This helps slow down bone loss. But not all exercises are the same. For bone health, you need weight-bearing and resistance exercises. Weight-bearing exercises are activities where you move while standing. These include walking, dancing, low-impact aerobics, climbing stairs, gardening. Even simple walking for 30 minutes a day can help. You do not have to do it all at once. You can break it into 10-minute walks 3 times a day. Walking is gentle, free, and easy to start. If you walk with a friend, it also helps with motivation. Now let us talk about resistance exercises. These are also called strength training. They help your muscles and bones get stronger by working against a force. Examples include using resistance bands, lifting light weights, doing bodyweight exercises like squats or wall push-ups, carrying groceries, getting up from a chair without using your hands. You do not need to join a gym. You can use cans of food or water bottles as weights. Start slow and focus on proper form. If you are not sure what to do, ask a physical therapist or trainer who works with older adults. They can show you safe exercises for your level. Balance and flexibility exercises also matter. They may not build bones, but they help prevent falls. Good examples are a Tai Chi, gentle yoga, standing on one leg while holding a chair. These exercises improve your balance and help you move more confidently. Fewer falls mean fewer broken bones. Try to be active most days of the week. If you are new to exercise, start with 10 to 15 minutes a day and increase slowly. Even small efforts can make a big difference, and remember, it is never too late to start. Many studies show that even people in their 70s and 80s can improve bone strength with regular activity. Just keep moving. Some habits can quietly damage your bones over time. Even if you eat well and exercise, these habits can undo your progress. Let us talk about what to avoid if you want to protect your bones. The first habit is smoking. Smoking harms many parts of your body, including your bones. It slows down the cells that build new bone. It also makes it harder for your body to absorb calcium. Studies show that smokers have lower bone density than non-smokers. They also have a higher risk of fractures. If you smoke, try to quit. Even after many years, quitting can help your bones recover. Talk to your doctor about ways to stop smoking. There are many support options today. The second habit is drinking too much alcohol. Small amounts of alcohol may not be harmful, but heavy drinking weakens your bones. It also increases your risk of falling. For older adults, the safe limit is usually no more than 1 drink per day. That means 1 glass of wine, 1 shot of liquor, 1 can of beer. Drinking more than that regularly can reduce bone formation. It can also lower your body's ability to absorb nutrients. The third habit is being too sedentary. Sitting for long hours each day is harmful for bone health. Your bones need movement and pressure to stay strong. If you stay in bed or on the couch most of the day, your bones begin to weaken. Try to break up long periods of sitting. Stand up, stretch, walk around, or do light tasks every hour. The fourth concern is not getting enough sunlight. Your skin needs sunlight to make vitamin D. If you stay indoors all the time, your body may not make enough. Try to spend 10 to 15 minutes outside in the morning or late afternoon. Expose your hands, face, or arms to natural light, but avoid too much sun in the middle of the day, especially without protection. If you live in a place with little sunlight, especially in winter, you may need a vitamin D supplement. Another habit to watch is too much salt. Eating lots of salty foods can make your body lose more calcium in urine. This may lower your bone strength over time. Common high-salt foods include canned soups, processed meats like bacon and sausage, fast food, chips and crackers. Try to read food labels and choose low-sodium options when possible. Also, cook at home when you can, so you control the amount of salt. Some people also drink too many soft drinks, especially colas. These drinks may contain phosphoric acid, which may affect bone health when consumed often. They also often replace milk or healthier drinks in your diet. Choose water, milk, or fortified plant milks instead. Save sugary sodas for rare treats. To sum up this section, avoid smoking, limit alcohol, move your body, get some sunlight, reduce salt and sugary drinks. Small changes in your daily habits can protect your bones for years to come. Some medicines can weaken your bones over time. Even if they help with other health problems, they may have side effects that affect your bone strength. It is important to know which medications might raise your risk for osteoporosis. The first group to know about is steroids. These are also called corticosteroids. Doctors often prescribe them for conditions like asthma, arthritis, or lupus. Examples include prednisone and dexamethasone. If you take these medicines for a long time, they can slow down bone formation. They may also increase how fast you lose calcium. People on long-term steroids often need a bone health plan. The second group is some acid reflux drugs. These are called proton pump inhibitors, or PPIs. Examples are omeprazole and esomeprazole. They reduce stomach acid, but your stomach needs acid to absorb calcium well. If you take PPIs for many months or years, your body may not get enough calcium. This can weaken your bones. If you need these medicines, ask your doctor if you can take a lower dose or use them for a shorter time. Also, take calcium from food instead of supplements if you are using these drugs. The third group is some seizure medicines. Examples include phenytoin and phenobarbital. They may affect how your body uses vitamin D, which weakens bones over time. There are also certain breast cancer and prostate cancer treatments that lower hormone levels. These can cause fast bone loss. If you take these medications, bone scans and supplements are often recommended. Some people also take depression medicines called SSRIs. These may slightly increase fracture risk, especially in older adults. It does not mean you must stop these medicines. But it is good to talk with your doctor about your bone health if you take them. Thyroid medications can also affect bones, but only if the dose is too high. Ask your doctor to check your thyroid levels regularly to make sure they are not too low. You do not need to stop important medicines just because they may affect your bones, but you should know the risks. Tell your doctor if you are concerned. You may need a bone density scan or extra support to keep your bones strong. Also, let your doctor know if you take diuretics or blood thinners. These can affect how your body uses calcium, magnesium, or vitamin K. Always bring a list of your medicines to your appointments. Even over-the-counter drugs and supplements matter. Your doctor can help you balance your medications and protect your bones at the same time. That is part of good care. Since osteoporosis does not cause pain, you may not know you have it until a bone breaks. That is why bone density testing is so important. It helps you find out if your bones are becoming weak before a fracture happens. The most common test is called a DEXA scan. DEXA stands for Dual Energy X-ray Absorptiometry. It uses a low-dose X-ray to measure the thickness and strength of your bones. The test is simple and painless. You lie on a table, and the machine scans your spine and hip. The scan takes about 10 to 15 minutes. You do not need to change clothes or prepare in any special way. After the test, you will get a number called a T-score. The T-score compares your bone strength to that of a healthy young adult. Here is what the T-scores mean. A score above 1 is considered normal. A score between 1 and 2.5 means you have osteopenia, that is mild bone loss, but not full osteoporosis. A score of 2.5 or lower means you have osteoporosis. This test helps your doctor decide if you need treatment or changes in your lifestyle. Who should get a bone density test? Experts recommend testing if you are a woman age 65 or older, you are a man age 70 or older, you have broken a bone after age 50, you have certain health conditions or take medications that affect bones, you are a postmenopausal woman under 65 with risk factors like low weight or smoking. The test is safe and usually covered by insurance for people in the high-risk group. You can ask your doctor if you should be tested. It is better to know your bone strength before problems happen. Some people may also need repeat scans every 2 years to see if their bones are getting better or worse. The results can help guide your treatment plan. Remember, testing does not treat the problem, but it gives you the information you need to act early. Think of it like checking your blood pressure or cholesterol. Knowing your bone density gives you a clear picture of your bone health. Keeping your bones strong is not just about what you eat or what pills you take. It is also about your daily habits. There are many small things you can do every day to protect your bones and prevent falls. Let us start with fall prevention. Most fractures in older adults happen because of a fall. Even if your bones are not very weak, a fall can cause serious injury. Here are simple ways to make your home safer. Keep walkways clear. Remove rugs that slip or objects on the floor. Use night lights in the hallway and bathroom so you can see clearly if you wake up at night. Install grab bars in the bathroom. Place one near the toilet and one in the shower. Use non-slip mats in the shower and tub. Keep frequently used items within reach. Do not climb on chairs or step stools to get things. Wear well-fitting shoes with non-slip soles. Avoid slippers or walking barefoot on smooth floors. Get your eyes and hearing checked every year. Poor vision or hearing can increase the risk of falls. Use a cane or walker if you feel unsteady. It is better to use support than to risk falling. Next, let us talk about posture and movement. As we age, we may lose muscle strength and flexibility. This can affect how we walk, stand, and carry things. Try to stand tall when you move around. Do not rush. Take steady steps and look where you are going. When lifting something, bend your knees and keep your back straight. Do not twist your spine. Be careful when getting up from bed or a chair. Sit up slowly, then stand up when you feel balanced. Let us also talk about hydration. Drink enough water every day. Dehydration can lead to weakness, dizziness, and falls. Aim for about 6 to 8 cups of water daily, unless your doctor gives you a different amount. What you wear also matters. Wear clothes that allow you to move freely. Avoid long, loose pants that can cause you to trip. Now let us talk about routines that help build healthy habits. Try to eat meals at the same time every day. Add a fruit, a vegetable, and a source of protein to each meal. Take your supplements at the same time each day so you do not forget. Make a daily movement plan. Even a short walk, some stretching, or a few strength exercises each morning or evening can make a big difference over time. If you live alone, consider a check-in system with a friend or neighbor. Falls can happen when no one is around. Having someone check on you regularly is helpful and reassuring. You can also join a community center, a walking group, or an online exercise class for seniors. Staying socially active helps keep your mind and body strong. Lastly, take care of your mental health. Stress, depression, and anxiety can lower your energy and make you less active. Talk to someone if you feel down. A healthy mind supports a healthy body. To sum up this part, make your home safe, walk carefully, stay hydrated, stand tall, move every day, stay connected with others. We have talked about many things in this video. Now let us bring it all together. Osteoporosis is a silent condition. It does not hurt. It does not show signs until it is serious. But that does not mean you are helpless. You can take control and protect your bones starting today. Remember this, calcium is important, but it is not enough on its own. You also need vitamin D, magnesium, vitamin K2, and protein. These nutrients work together to keep your bones strong. Try to get them from real food whenever possible. Exercise is just as important as food. Your bones need movement to stay healthy. Walking, stretching, lifting light weights, all of these help build and protect your bones. You do not need to run or do anything extreme. Just keep moving every day. Avoid habits that damage bones. Quit smoking if you smoke. Limit alcohol. Cut back on salty and sugary foods. Be careful with certain medications and talk to your doctor about your risks. Get your bone density checked if you are in a high-risk group. This simple test can give you a clear picture of your bone strength. It can help you take steps before problems begin. And take care of your daily life. Make your home safer. Prevent falls, drink water, stay social. Keep your body strong and your mind active. You are never too old to start caring for your bones. In fact, the sooner you take action, the better. Even small changes can make a big difference over time. Talk to your doctor or health provider if you have questions. Share what you have learned with friends or family. Support each other. Learn together. Move together. Strong bones help you stay independent. They help you do the things you love. They help you live with confidence and comfort. Thank you for watching. Take good care of yourself. And remember, it is never too late to build better bones.